Today, I'm talking with Dr. Daryl Marx, Medical Director of Our Lady of the Lake Robotic Surgery Institute and a robotic general surgeon specializing in general, bariatric, and robotic-assisted surgery using advanced, minimally invasive techniques. Robotic surgery is changing the game in patient recovery, and Dr. Marx has paved the way for this innovation in care. He's considered the #1 robotic surgeon in the South, and that's based on nearly 5,000 surgeries he's performed using the daVinci robotic systems. He also trains the next leaders in robotic surgery from around the region. We think about Our Lady of the Lake Robotic Surgery Institute. We know it's powered by experience and leading with innovation, and Dr. Marx is at the helm of that work. In this conversation, he goes into so much detail about all of the reasons why robotic surgery is so much more precise and safer than open surgery and how far it's progressed over the years. And Dr. Marx is operating at the top level when it comes to robotics and these types of surgeries. And that's why he's so sought after as a trainer of the next great robotic surgeons. I'm so impressed by his knowledge and experience in robotic surgery space, and it's clear he's really found his calling and driven by helping people get back to their lives. So with that, let's dive into our conversation. Welcome, Dr. Marx. Thank you so much for being here.
Thanks for having me.
Of course. Well, let's get started with the basics. Tell us a little bit about you and the work that you do at Our Lady of the Lake and your medical background.
So I'm a robotic surgeon. I was recruited to the lake about a year and a half ago to help run the robotics program here. I've been in robotics since 2011 and have performed close to 5,000 robotics procedures at this point. My area of expertise is really minimally invasive, but I am by training a general surgeon. So basically from stomach problems to cancers to anti-reflux problems to bariatric, I mean, you name it, if it's in the belly and needs to be dealt with, then that's what I do. I did all of my schooling in Louisiana, trained here at LSU in New Orleans, and then spent some time in Monroe in private practice before coming here.
That's awesome. Are you from the Baton Rouge area?
I'm not. I'm from the northern part of the state. I was born in New Orleans, but have been in Monroe for the majority of my practice and early life as well.
Oh, okay. That's great. Are you enjoying Baton Rouge?
Absolutely. Yeah, really. It's a nice place. I've been enjoying a lot of what Baton Rouge has to offer, and as well as being close to the Gulf, and being close to New Orleans and being close to airports that are large and, nice, normal things that you don't necessarily have access to in some other areas of the state.
Yeah, absolutely. It's so important to be able to travel and to be able to fly out pretty quickly. So I'm curious, what led you to your specialty and really pursuing a path in surgery?
My path was very direct. My father, my grandfather, and my uncle are all physicians and all surgeons to some degree, mainly urology and proctology. But I had an early aptitude for taking things apart and putting them back together. Whether it be a machine or a frog or, whatever it was, I was into it. I was good with my hands. And so I needed a career path that gave me some outlet for taking things apart, putting them back together, and using my hands in very intricate ways. So I worked in the hospital growing up. My father helped get me a job at a local hospital in Monroe and started mop floors. I started out in high school mopping floors and getting patients and cleaning up after surgeries, and then eventually worked my way up to working in sterile processing, where I cleaned the dirty instruments after surgery and then assembled them back into their packages appropriately. And I did that for several years, and eventually worked my way up to where I was actually scrubbing as a scrub tech in the operating room through college. And so I got exposed to really everything in a hospital from the front door to the back door, including where the trash goes and where the dirty, everything. I've been raised in a hospital, so I found a lot of interest in general surgery during that time. It was a long time ago. Obviously, it was in the 80s and late 80s, early 90s, and there wasn't a lot of minimally invasive surgery. It was a lot of open surgery, which was obviously very fascinating to a young mind and young eyes to see this taken apart and then put back together somehow. And opening the abdomen at that point was very much like it was a surprise. Like you had no idea what you were encountering every day, and the surgeons had to be able to think on the fly and come up with solutions and answers and fix problems real time. And that worked well with my brain, for lack of a better way to explain it.
Well, that is a nice segue into getting into the basics about robotic surgery and helping our audience understand what is it and maybe what is it not, as well as some advantages of robotic-assisted surgery versus other types. Like you mentioned, open surgery.
I use primarily the daVinci operating system. That's the most commonly used robotic system in the world, really. There have been multiple versions of this robot over the last 20 years. Currently at the Lake, we have the XI machine and an SP. They're just they have been the top of the line machines until they're still the top of the line. Don't misunderstand me, but they've come out with a new version of that within the last few months. So it's not the newest machine, but it is very similar to the latest machine. The old SI and were a little bit more difficult and cumbersome to use.
Wow, we've got visuals.
That's what the machine looks like, okay? That gives you a view of what the XI is. So these arms are controlled by me real time away from the patient. I'm just 6 or 8 yards or so from the patient, but I control all those arms that hover over the patient. And as you can imagine, from a physiologic standpoint, for a surgeon, we can only be in so many places, and our arms can only do certain things, and we only have 2. So at least at present. But this has 4, and it comes in from the top. So that means you've got really interesting access to the abdomen. And even when you think about laparoscopic surgery, where you hold instruments in your hand, you can only hold them over the patient, and you can't twist around. And this will do all kinds of things that make our job possible inside the abdomen. So benefits of robotic surgery really are, for the patient, obviously, it's brisk recovery. We've gone from long hospital durations for open surgery and no heavy lifting for 6-8 weeks because you don't want hernias, to outpatient procedures that are of the same magnitude. Okay, so if you take a big stomach operation, those patients would be in the hospital for a week. Now they go home the same day or next day eating with no pain, and because you don't make a big cut on the abdomen, there's no longer this heavy lifting restriction because there's no risk of hernias in the wound. So everybody gets back out into the world much faster. The camera with the robot magnifies everything 10 times. So when you talk about, for example, one thing that we don't like in surgery is bleeding, and that's not something we're particularly fond of. It is something that occurs in the business, but it's not something that we're really attracted to. And being able to have the blood vessels magnified 10 times and having special sealing technology that seals blood vessels and tissue, very, very similar to a vacuum sealer that for plastic. I mean, it seals things that good. So you really don't ever have bleeding. So when you have a magnified field, no bleeding, means you can see what you need to do. That means you can do it. And in a lot of cases, perform it faster because it's right there. I mean, I an open operation, I'm, so far away. So for me, it's been a mesh of my aptitude with my desire for outcomes. So one of the things that's very difficult in my profession is hurting people. I mean, it's not easy. It's something I think about all the time. It is not pleasant to think that I'm going to physically induce pain on somebody. And then when they're in the hospital, you have to listen to it every day. So, I mean, it's what we do, yes, and we wear the white coat, and it's very, endearing, but it's also a huge anvil. And so anything that you can do to minimize pain, minimize hospitalization, minimize infections, increase outcome or benefit outcomes, then makes perfect sense. It's awesome, right? That being said, not everybody is a robot driver. I mean, it is not for everybody. We are training surgeons here at the lake every day, all day, to use the robots. We work with skilled surgeons that are already out and practicing, that are 10 years out of their training. We take a fellow every year that's finished with their general surgery residency. So they're 5 years in. They could go out and work, but they come spend a year with us to learn these techniques. And then we also work with the junior doctors that are just finishing medical school and bringing them along. So it's definitely crawl, walk, run, sprint to some degree with some of us in terms of what we do with this. The robot for me was like giving Dale Earnhardt a race car. It was a marriage that met very quickly.
That's awesome to hear for sure. Can you give us an idea of the range of surgeries that we do that utilize a robot?
Sure. So it's probably best to tell you what we don't use with the robot because we'll be here for a minute, but I'll go ahead and start. So if you think about things from the top down, I'll just cover what we do with the robot from the top down. Now, this is not just me. This is other specialists in the lake. So starting with the oral pharyngeal cavity, we have the single site operation robot, which is the SP, and they do base of tongue, oral pharyngeal cancer surgery through your mouth. Understand that before we had this, you would have to open the jaw this way, could sometimes disarticulate the jaw to get down here, or make an incision here, or sometimes a hockey stick. Now, so the SP allows us to go transoral. Our thoracic team does lung surgery robotically through the poke holes in the chest. Dr. Cassidy and Dr. LeBlanc do those. I work with Dr. LeBlanc as well. We do esophagectomies, which are the esophagus runs in the chest all the way to the abdomen. Moving down, liver surgery, cancer resections for liver, benign disease, diaphragmatic hernias, hiatal hernias, abnormalities of the diaphragm, congenital, in other words, that things that people are born with, gastric tumors, resected gastric cancers we remove, pancreas, pancreatic cancers, pancreatic tumors, spleen, adrenal, gallbladder all day long, small bowel problems, bowel obstructions, gastric bypass, sleeve gastrectomy, abdominal wall reconstructions for hernias, colon surgery all the way across for benign and malignant disease, urologic procedures, nephrectomies where we take the kidney out or part of the kidney, bladder surgeries where we take the bladder out or parts of the bladder. That covers pretty much every organ and every system in the body other than bones and brain. So those are that's what I said. It's easier to tell you what we don't do with it. The lake we don't have GYN at the lake. But gynecology is obviously done robotically quite robustly across the country. And prostate surgery we do here as well. That was one I didn't mention. I mentioned kidney, but not the prostate. So basically from here to the bottom, the SP we also utilize for transanal surgery to take tumors out that would otherwise have had to been done another way.
That's incredible. It's really amazing to hear there's a large range of options that patients could take advantage of in any kind of area they're having or needing surgery in. They can also take advantage of the recovery that's possible with such a minimally invasive procedure and operating technique.
Correct. It's a minimally invasive surgery platform. The thing that people get lost in the weeds a little bit with robotics is they want to know, does it do anything by itself? Do you just hit play and you go drink coffee and you talk with your friends? No. No. There's none of that occurs. It is actually my hands making motions that the machine is parroting, scaled to the appropriate movement for the operation. It's very much like driving a four-arm backhoe. You've got switches, we've got pedals and switches and handles and all this stuff that we can do tasks with the machine. Now, the interesting thing is that moving forward, the new robot that's out will have AI features built into it, which are going to allow us to do some very creative imaging work real time in the console. So we can bring images into the surgeon's console where we see the image, the 3D high def view of what's going on in the patient, but you can import information to use real time. Like you can have your EKG machine running with what's going on. If you're doing heart surgery, you can have, if someone's doing an endoscope or they're in someone's mouth, you can have that view in the corner. Moving forward, we're going to be able to put CT images that and put them in and then superimpose the CAT scan images on the patient's anatomy so that we know exactly where blood vessels are and tumors are, and we don't have to use our instinction. I mean, it's going to get really, really interesting in the next 10 years. It's really going to be cool.
That's incredible. It sounds like what you're talking about before, that responsibility that you hold to prevent injuries or hurting people, and your approach can prevent more of those incidents from happening during a surgical event.
Correct. I mean, there's so many safety features that are built into the robot. The other real common question I get is, what happens if the power goes out? What do you do? Well, there is a battery backup on the machine, but I mean, you could say that about anything in the operating room. I mean, if the power goes out, it's a problem no matter what. That's why we have big generators. It's all good. You don't have to worry about it.
Well, that's what I was going to say. That's why we have good generators at the lake. That's right.
We made it through Katrina. We're going to be fine. The other common question that I get is, well, my doctor says that he needs to put my hands on it. He needs to put his hands on it because he has to do things the old-fashioned way. Well, I think that there are some situations where that may be very important, but not many anymore. Our eyes have become our hands, and the visualization, the 3D, the ability, you can develop a sixth sense of what things feel like and what they feel like with your eyes. The other question mark that I get oftentimes is, how is it different from laparoscopic surgery? Why is it better than lap? It's more expensive. It's more of this. Why? Well, again, I'll go back to my anatomy lesson, which is I only have two arms. Okay? I have only two arms. The robot has four that I can control real time. A laparoscopic operation requires a third party that is not typically a surgeon to drive a camera to look where I want to look. If you could only imagine watching a TV show or a movie with somebody else's eyes that you have to tell them where to look for you to see what you want to see, how frustrating that would be. and then have somebody's life depend on it. Okay, so it's very, very complicated. So the robot allows me to control my camera real time. Like it moves with my eyes now. After 5,000 of these, I can control it faster than my eyes. The other thing that's underrated, I think, is that the instrumentation is standardized. Like, I don't have to worry if I go to another hospital to do a robotics operation. I don't have to have my special widget that I use because they don't have my little thing. They've got all this instrumentation is standardized. And there's so much built-in knowledge of what's going on with particular steps in surgery that you don't get with laparoscopy. And without trying to be too technical, there's a lot of mechanization and steps in the operating room that the robot helps with.
It sounds like it. And it leads me into my next question. You're known as the #1 robotic surgeon in the South. You have vast experiences with this technology that has evolved over the years. And I'm curious about your first and early experiences with robotic surgery and how you've seen things advance since then.
My first experience with the robot was I didn't want to deal with it. I didn't want to have anything to do with the robot. I trained. I was a laparoscopic expert. I was already out 10 years. I'd worked really hard to develop the techniques, and I was good with the laparoscope. I was as good as I think people would want. But some problems that I was running into was limiting me in terms of what I could do moving forward. And so I went and watched a robotic operation in Shreveport, which was just right around the corner. And I watched the wristed instrument do this with sewing. And understand that with laparoscopic instruments, you can only do this. You've got none of this. And it was love at first sight. That was it. I knew it was better than me by myself with those stupid stick instruments. I knew it was better, and there was no telling what we were going to be able to do with it. And it was an early generation machine. So then it was very exciting. It was very fun. It had it was a lot of fun getting people involved, and the town and the city and the state was really excited about robotics and what does that look like. And 2011 was a long time ago. There was not a lot of excitement in medicine at that point. The next phase was really learning how to really work it. Like, not just, hey, I'm a robotic surgeon, I do this and get through some cases and do good work, but really master it, really get it under your fingers and understand and then push it. How far can we take this? What can we do next? And that requires a lot of time in a lot of cases, and an understanding tension visually. Like being able to look at a rubber band stretched from a distance and saying, that's too tight. It's going to pop any minute or not. Breaking suture one after the other to see what it looks like right before it breaks. I mean, all those things, it's like training for anything else, whether it be Olympics or throwing a football or doing surgery. I mean, it's a contact sport. And so you have to get used to the technology. And then it really started evolving. The machine changed. How we bring the machine into the patient changed. It got a lot easier. They changed the instruments around a little bit. They retooled the patient cart, which allowed for easier movement. We've got a table now that is integrated with the robot. So the arms are coming in like this. The table is like this. And if we want to put the patient head down, it all moves in synchrony. So we can use gravity. We don't have big retractors and pack bow off and stuff. We have to use gravity. So now we have this whole simultaneous system that allows us to manipulate the patient on the table to get better exposure. We don't have to bring the machine in multiple different directions for different quadrants of surgery. We can just leave it be and it will reach all the way around. So, it's not changing. I mean, it's continually to grow. Like I picked up 3 new procedures in the last 4 years. I mean, when in the world do surgeons pick up new procedures after you do the same thing used to from the day you started until you finished. And this is uncharted waters where we're going and what we're doing with this. So it's really exciting.
It definitely is. It sounds like it. And I know our region's thankful for you trailblazing the way in this space, and countless patients who've reached quicker recovery times, I'm sure as well, are grateful for that and saving their lives. I know you mentioned a little bit about AI and how that's integrated in and coming to be a part of robotics. And so I'm curious, is there anything else in the field that you're looking forward to in the future for those you're training now?
Well, what I'm looking forward to is people coming out of their training competent with robotic surgery. And so that we have a working pool of robotic surgeons that can take care of me when I'm older and need something done, because the need for that is important. With every new step in technology, especially within the medical field, there are factions that want to eliminate it, that want to preserve the way they do things. They don't want to get on the learning curve and learn how to do something. So there's this push to keep it subdued and make it sound like it's too expensive or too hard or not worth it, or the outcomes aren't really good. But when you look at statistical analysis and some of these other or journal papers, you can make numbers look however you want. You just have to have the right sample pool and you can skew it. So that's been a hurdle, and I think that that's finally going away. So the future is bright for those that are getting involved, so they don't have to fight to do it. I mean, when I started, the hospitals did not want to have any part of robotics because of the expense. I mean, it was a $2 million machine, and they already had all this laparoscopic equipment, and everybody was comfortable. And you want what? Why? What's up with that? We don't even know what that is. The AI experience is going to be very interesting moving forward, because what it's going to do initially is the robot is going to track movement. They're going to track our hand movement, our port placement, our instrument choice, our everything. And then at the end, we're going to get a report on where we could improve, where we were slack, compared to 35,000 other operations that have been done the same one. Why are you slower? Why are you need to, and then they'll build a training module that you can go to a simulator and work it out to get as good as the best that's out there. They're going to give you feedback on your timeliness of exchanges. It's going to give you feedback on better ways to do the operation. And eventually, now this is just me talking off the top of my head. Eventually, it's going to give you in the corner, it will give you a decision tree for different times in the operation. The robot will learn the operation, it will learn the anatomy, and will see situations. And just like you see in some of these robot view fields, it's like, oh, if you do this, there's an 80% chance of a problem. If you do this, there's 20. And it's going to give you a list of choices and percentages that are just references for you in terms of how to get through some of these things. That's how I think the future is going to improve. The other thing that's great that's here now is we have teleproctoring. So if I'm in my office, like I'm talking to you all on this, I can be asked on my phone to log in to somebody's operation in the hospital or in our system, which is 5-6 hospitals across 2 states, and say, hey, no, you need to. I can be looking at it on my computer monitor and give them counseling and guidance real time from somewhere else. And that's going to be a big part of how we mentor and train people moving forward.
It really is incredible to think about all those advancements and what's coming down the pipeline for sure. Earlier, I alluded to the fact that you are the #1 robotic surgeon in the South, and at Our Lady of the Lake, we have the largest fleet of surgical robots in Louisiana and have a larger role in training other surgeons. And I want to dive deeper into that. I know you and other Lake surgeons train a lot of the surgeons throughout the Baton Rouge region and elsewhere, and they're all coming here to speak with you to watch you perform surgery, learn from you. And so what does that mean for our standing as a health system? But then also, what does that mean for patients who come here as well?
We train experts here. We train the new experts. We train the experts to be experts. We have people come through that are seasoned veterans that want to get better. I mean, this is where high-end robotic surgery is performed on a regular basis. I mean, the hardest of the hard falls into this facility, which is what attracted me here as well. We do a lot of revisional surgery and a lot of corrective surgery, and it's great for student doctors, medical students who are interested. They want to see. They don't know what's going on. They get a chance to see real heavy-duty robotic surgery. The training that we do for the residents, which are doctors, is outstanding. I mean, they're going to leave here really not needing a fellowship in robotics, which is, we provide that as well. This program here has trained most of the robotic surgeons in Baton Rouge. The people that call them experts are trained here. So yeah, I mean, this is the Hopkins, the Mayo, or whatever you want to call, whatever Cleveland Clinic of the South. I mean, this is where it happens. This is where miracles happen and lives are changed. And we push surgery and we do studies. We are involved in research. I mean, we not only take care of patients like they're our family members, we are also constantly in search of better ways to do things because we're just not satisfied. We're still hungry. And that is infectious. That's contagious to the people that are around us, which makes them want to come and do more. So, and I have to say that the other thing that's nice is the hospital administration here, although there's been a lot of changes, are very on board with robotic surgery, which is usually the biggest hurdle that we have in an academic teaching institution, and all the moving parts is that getting equipment and getting the resources we need to train and having a dedicated simulator. Like we've got a flight simulator for surgery. That's a robotic, they can go do stuff and not be on people. I know people think that they're not being experimented with at all. I mean, that's not the case. There's a ton of work that goes into what happens before a physician is allowed to operate with me. So did that answer your question?
That definitely answered my question for sure. And well, as a follow-up to that too, you said earlier that what really got you interested in surgery was the ability to use your hands and to make this happen. And I'm curious now, because your hands are operating this robot, is it a different way of using your hands? I can also tell how interested and passionate you are about these next advancements and being on top of what's next. So it seems like you're just as excited to find new ways to use your hands to make surgery happen and make it happen in the safest way possible too.
That's exactly correct. And the truth is that as we get more experienced, if you will, age, these get tired. Okay. Joints get sore, shoulders give out, and what the robot does that is it's sort of a unsung benefit is, and again, having done a lot of robotic surgery, one of the disadvantages initially was you don't feel anything. You can't feel. I lost my feel. Now I don't want to feel anything. It's nice just to operate in the air. I know what I'm feeling with my head. I don't have to feel it. So for example, these bariatric procedures, patients' abdominal walls can be this thick. And then if you're doing laparoscopy, you're trying to work and the instruments are bending on the abdominal wall and you're struggling. Well, this, you can't feel anything. It's great. You can be so pinpoint precise without any effort. So, moving forward, that's been a big part. And it is very technical. I mean, the fine motor skills that you have with the robot are maybe even more than with open surgery. Although the robot does filter out, an intention trimmer if you have one. I'm making one up. That's not mine, but I don't want to give the wrong perception. But it will filter that out. So if you do have a little trimmer, like some people do, especially holding long instruments, hold a pool cue out straight and look and see how much the end wiggles when you're holding. It's a lot. So it filters all that out. And it will prolong our career as surgeons because, we sit down for the operation. We're comfortable. If you're comfortable, if you can think, if you're not stressed and strained and physically sound, then you can think better. So, there is some other stuff that you have to learn. Your proprioceptive skills, in other words, knowing where your hands are in space and where the robots are in space, is a technical skill set, I guess. It's not sewing, with a little needle and doing real, painting, fine motor skill stuff, but it is intriguing for the brain to somebody who's interested in technical detail.
Absolutely. Well, and it seems like they can come to you and learn from you on the best way to lean into those techniques and skills, right?
Sure. I tell people all the time that speed is not about fast hands. Speed is just being efficient with the motion that you need to use. It's not about hurrying. Nobody who finishes in a hurry finishes fast. They usually mess up and make it mistake, and then that lasts longer. So.
Well, and going back to what you said just about the health system administration really supports and sees the need for robotic surgery. And I believe a lot of that is because there's clear benefits to the patient. How do you balance putting the patient at the center of care and operating at the highest level of excellence? How do these two go hand in hand in your work?
Well, there's so many, and every operation is important. Every patient is special and unique, and there's no, and everybody, I think, having been a surgical patient as well, is very humbled and appreciated by having a successful procedure. So, everybody that I operate on, even if I'm taking their gallbladder out or repairing their abdominal wall or whatever it is, or retooling their intestinal system for weight loss or taking out cancer, they are all absolutely impacted and grateful and thankful. And it's so wonderful to see people back in the clinic that I've done this massive operation on, and they're back in the clinic at a week going, I feel a little tired in the afternoon after I finish mowing my yard and doing all these things. I'm like, you would be still in the hospital now if we hadn't done this way. It's so great. I love that complaint. That's wonderful. How come I can't do more? It's great. Those are the home runs of robotics in terms of patient testimonials.
That's incredible.
The administrative part is really complicated, and it takes some time for the administration to understand that you have to look outside the operating room for your cost savings in robotics, because it is more expensive in the operating room. But if you have a patient, say, for example, I do a colon resection on them. I take out a segment of their colon for cancer, an open operation. They'd be in the hospital 5 to 7 days, maybe an ICU stay, maybe a blood transfusion, maybe a wound infection, maybe a hernia. All that's very expensive. When you do it robotically, they go home the next day.
To shift gears a little bit, can you tell us about your interests outside of medicine?
I'm intrigued with the complex simplicity of craft barbecue, and it's a nuanced science. It's a nuanced art. It is it's a lot of fun, and I'm fascinated by people who have done really, really well in it. Aaron Franklin is one of them who's out there, who's been very, very, he kind of revolutionized modern barbecue, but it's It's chemistry, it's fire, it's food. I mean, how can you not like it? But I'm just intrigued with people's creativity and how can I blend that into my own vibe of barbecue for the Deep South.
That was going to be my next question. Are you using this and applying it at home?
I am. I cook a lot. I do, and intend on doing some more cooking adventures with maybe some catering events and pop-up events here and there as I get more and more and test it out properly. We're doing really good. It's a lot of fun. I'm happy with where it is, but that's been sort of my obsession of the last, I guess, year or so.
That's awesome. I want to give it a try. I'm curious.
Okay. I'm always looking for mouths. You can't buy one rib. Well, you can, but it's not that great to cook one rib.
Yes, I can be your taste tester. I'll volunteer.
Yeah, I always need taste tests. Yeah, my wife is sick of it. She's done. She's also done. It tastes like the last time. But anyway, that's been a lot of fun, and it's a mental journey that's not as complicated. And I like to make people happy. You know, I like to see people smile. I like to see people get better. I like to see their bellies full. You know, it's just another way to serve, I suppose.
Well, before we go, is there anything else that you want to add or a final message to our audience and listeners about robotic surgery at Our Lady of the Lake?
Well, I think the take-home message for robotics is, number one, it's nothing to be scared of. It's not a procedure or a technique that should lend itself to any anxiety at all. I mean, if your surgeon is offering it, if your surgeon is competent, I mean, then it's the way to go. It's not complication-free. Just because you have a problem with an operation doesn't mean it was a robotics problem or anything. Complications happen, even in the best situations. I mean, this is not a plug-and-play machine. I mean, you just don't go to Napa and find a part and, you know, you have to heal. And so there are those aspects that people get sort of confused about. Well, I had a robotic operation. I should have gotten, well, you had a big operation still. I think those are some of the things that are most useful for patients to understand moving forward. That it is just a tool. It is nothing more than that. It's still the brains and the eyes and the heart and the soul of the surgeon who's performing the operation.
That is a good message to share for sure, and perfect way to close us out. Thank you so much, Dr. Marx, for taking the time to talk to us. It was really great speaking with you.
Yep. Thanks for having me. Okay, enjoyed it, y'all. Take care.
We'll have everything Dr. Marx mentioned and other helpful resources linked below. Thanks for listening.